One particular kind of anxiety is called OCD, Obsessive-Compulsive Disorder. It sounds like a very complicated disorder, but it's not really. It's the typical thing that people will check again and again whether they have got a cancer lump in any part of their body, if they've turned off the stove, if they locked the door. Some people get it about bacteria. They wash their hands a lot to get rid of bacteria. They cannot touch certain things. Other people have an obsession with order. They have to put order all the time. They have to put things symmetrically, etc. Other people have thoughts that they're bothered by. Intrusive thoughts, for instance. People can suddenly start thinking that they might hurt somebody, that they might throw their baby off the bridge, they might slice their children with knives, etc., etc. So, how can we treat these problems? For the behaviors, it's what we call exposure and response prevention. That means that you try to expose yourself for what triggers your compulsion, for instance, washing hands, and then you try to limit what you do. For instance, a person who is afraid of getting dirty and washes the hands for 10 minutes can try very carefully to wash for 9 minutes, 8 minutes, 7 minutes, etc. I recently had a patient who checked for sickness and cancer every morning for 10 minutes. So I said, okay, put on your mobile phone for 9 minutes, and then you check as much as you want, and then later you check for 8 minutes, and as the days go by, you try 7, 6, 5. She's done this for 6 months, and now she's down to not checking at all. She was down to checking 1 minute every other day, and finally she was able to stop completely. Another young man was obsessed with putting order and used all his time to keep things clean and to put order. He was admitted, and while he was admitted, the nurse who was responsible for him got the instruction to go in and put a mess in his things as often as she could. And his duty was to try to not put order for as long as he could. 1 minute, maybe 5 minutes, 10 minutes. Finally, after 2 weeks, he was able to leave the whole thing for the whole night. And then it was as if the spell was broken. So, just reduce the actions that you do to relieve the anxiety little by little. When it comes to the intrusive thoughts, there are several things that you can do. The first thing is to know that it is the opposite of what you are. If you feel that you want to slice your children with a knife, that's absolutely the thing you don't want to do. All people can have stray thoughts like this, but it's the people who are often the most moral among us, the most loving, who will be extremely upset by these ideas, and then they get stuck. Then you try to push them out, and the more you try to push them out, the more they will be stuck. So, the first thing is to know that it's quite normal to have these thoughts. Everybody can have it. More than 51% admit to these kind of thoughts if they get to answer anonymously. So it's not dangerous, you're not going to do it, it's exactly the opposite of what you are. And you can actually use one of the other techniques, the reconditioning technique, the visual reconditioning technique, also called swish, where you take the image that you have, and you don't have to be afraid of it, so you just place it in front of you, and then you take control and send it out and take in the image of yourself as being okay, as not being bothered about this anymore. Very efficient method. But the most important is probably to know that these kind of so-called intrusive images are normal. That everybody has them from time to time, and that it's because you fight them so much that you get a problem with it. So, to sum up, do less of the thing that you do to reduce your anxiety, for instance washing hands, little by little. If you're just patient and do it very gradually, you can get to zero relatively quickly.